Hi everyone, Elizabeth Scala coming back at you for another video related to recovering from elbow surgery. This video is actually related to you if you are preparing for surgery. And I want to ask you a question. How are you feeling? How do you feel about the upcoming surgery? For me, and my family will attest to this, my coworkers, my neighbors, anyone who would listen, heard me talk about how I was terrified of surgery. And I have another video as to why was I so scared. It was all related to the anesthesia, so I'll link up that video to this video. But I wanted to let you know that being afraid of surgery is a normal feeling. I mean, there are people that probably have had a lot of surgeries that don't fear it because they've had that experience. And I'm not saying they love surgery or they want another one, but the unknown factor for them, if you've had a lot of surgeries, is gone. If you have not had a lot of surgeries or minimal surgeries or what may happen, going back to that fear, being afraid of going to a surgery is normal. And I wanted to let you know in this video, there's some tips to help you manage those fears prior to surgery. One would be to talk to people and let them know. Don't hold it inside. Don't just tell people, I'm fine. Yep, I'm okay. I'm getting ready for surgery. And yet in your mind, there's terror, and in your gut, there's lots of churning, and you're just worried. So for one thing, tell other people. Secondly, what is it specifically that you're afraid of? If you can pinpoint what you're afraid of, you could probably prepare better. So for me particularly, I was afraid of the anesthesia and all that came with it. I was able to speak to the anesthesiologist prior to the surgery, and honestly, it put me much more at ease. So pinpoint what your fears are and see if there's someone on your healthcare team. Well, it be your surgeon, it could be your primary care doctor, it might be a nurse practitioner, a nurse in the place that you're going to have surgery at. Even myself, now that I've gone through it, if you have questions, leave them below. But if you pinpoint exactly what you're afraid of, then you can articulate your questions ahead of time. And if you can get questions answered, that would reduce some of those fears of the unknown. And then after you have asked questions and been able to talk to healthcare providers and prepare yourself for what's to come, be ready for surgery day. And how can you do that? So the first thing is definitely get a good night's sleep. Avoid drinking alcohol or using any type of drugs. Get a good, restful, restorative night's sleep. There's an awesome app that I use called Insight Timer. And every night before I go to bed, I either listen to sound healing, quartz crystal bowls, a meditation, Reiki, some type of sleep sounds. There's actually certain delta, beta, some waves in sound. I'm not an expert, so I'm just throwing words around. But there are some sound waves that really help us prepare for sleep. So you might consider that. But get a good night's sleep. Wake up well ahead of time prior to the surgery. So let's say you have to be at surgery at, let's say, 9 o'clock. And let's say it takes you 30 minutes to drive there. So you have to leave your house at, let's say, 8:30. Don't get up at 8:15. You may not, that's ridiculous, but you never know. But get up at 7 o'clock, be able to wash your face, maybe do some breathing exercises or some other healing modalities even before you get to surgery. Leave with a good amount of time in case traffic or some kind of accident happens on the road. You never know. You don't want to be rushing. And finally, it's all about the energy. It's all about the choice. So for me, I'm going to give you an exact example of what I would say. If I don't want to feel nervous about the surgery, I don't want to feel nervous. If I don't want to feel nervous, I want to feel calm and peaceful. Okay, so I took the opposite of what I didn't want. I don't want to feel nervous. I want to feel calm and peaceful. However, I'm still like this, right? And my head is still like, we're worried. So you have to gently invite, I'm feeling calm and peaceful in. Your body and your mind and your spirit are maybe kind of doubting you. You're not peaceful, Elizabeth, you're worried. So I would say, I choose to feel peaceful. I choose to feel peaceful. And that word choice gently invites our subconscious to get along with what the words that are coming out of our mouth. So if you don't want to feel scared, what do you want to feel? If you don't want to feel anxious, what do you want to feel? Find what you want and then say, I choose to feel that way. So you can get there, you can do the surgery, you can go through it with flying colors. Don't be afraid. Be ready. All right, so what other questions do you have to get yourself ready for surgery? What other questions do you have about elbow surgery? Like, what are you not sure? What are you expecting or anticipating? Like, what's still bumbling around in your mind? Let us know. Leave a comment. Leave that question below. And visit me at elizabethscala.com for more elbow healing information and resources. See you next time.